A roadmap for healthy longevity. Countries are being urged to act now to help older people live more fulfilling lives as populations rapidly age. And for more on this, we're joined by Professor John Eu-Li Wong. He's co-chair of the Commission for a Global Roadmap for Healthy Longevity at the USA National Academy of Medicine. He's also Senior Vice President of Health Innovation and Translation at NUS. Professor Wong, 1 in 4 Singaporeans will be aged above 65 by 2030. So that's in just 8 years' time. What would Singapore look like then? And if you are aged above 65, what would Singapore look like to you then?
Well, I think it depends on whether someone is healthy or not. If someone is healthy, I think life should be full of opportunities. And current Singaporeans would, have an average of 20 more years if they're 65, and if by 2030. So I think it really depends on one's health. If one is not healthy, then of course life would be very, very different. And so that's one reason why we really encourage Singaporeans to stay healthy.
Health is one issue, Professor Wong, and the demographics of older people. It's not going to look the same across the board. How is Singapore preparing to accommodate the varying needs and wants of older people?
Well, again, I credit the government. I think they've been thinking about this for more than 20 years at least. The Ministerial Committee on Aging released the action plan for successful aging in 2016, outlining 12 themes, which were very comprehensive. Actually, the 12 themes mirror the themes of the U.S. National Academy of Medicine Global Commission's report. Everything from work, volunteerism, education, housing, transportation, healthcare, looking after the vulnerable elderly, and investing in research on aging. So I think Singapore is looking at how to present a comprehensive plan, cutting across all demographics. And I think Singapore has invested significantly in all ages. The action plan for aging was last year was renewed, looking at care, connectedness, and I think that Singapore is constantly looking at how to ensure that it plans ahead for the future. And makes sure that its plans are as comprehensive as possible.
Professor Wong, one of the recommendations in this report is for public-private partnerships to design intergenerational communities, which are, we're told, user-centered and cohesion-enabling as well. Now, all these words to me don't make as much sense as perhaps they should, because the community, as far as I know, is necessarily intergenerational and is always cohesive, generally speaking. So the bringing of public-private partnerships, how does it make communities even more so, given that we are facing an aging society?
Well, okay, so let me start off by saying that any efforts at really ensuring that our population stay healthy involves the whole of society. It involves the public sector, the social sector, and the private sector. So everyone has to work collectively for the betterment of the community that it serves. So that's that's the starting point. User-centered design is something which I think people underappreciate, where you do need to get the people that you are trying to design whatever product for actually involved in the development of whatever you're trying to do. So in this case, if we're trying to build communities for all generations, the people actively involved in planning and design should involve young adults, should involve working parents, and it should involve older people, because each will bring a different perspective to the design. And that's what user-centered design is so important. You actually get the end user involved so that the interface, when product is actually developed, it meets their needs. There's a very nice, I read a very nice paper actually from Manchester where they call it a design for life. And it's actually, they say that in their manifesto, you design an environment which makes life good. So what are all the elements that makes life good for different ages? And I think that that's something which would be ideal. And I think the public sector has its share of expertise. The private sector also has its share of expertise. And if they both could get together and contribute their input, I think the end result would be better for all. I think it really depends on the development. Singapore's Housing and Development Board is a great success, and that's a public venture. I don't know of housing which is public-private, but I think that that's something which should always be considered. I don't think we should take intergenerational cohesion for granted, because I think that's something which we should constantly make sure that we enable. Because young people want to do some things, older people may want to do some things, and you want to try and make sure that whatever space you create allows them both to intermingle and feel comfortable and safe.
How to age well better and into the future. An important conversation to have. Professor Wong, thank you very much for that. That was Professor John Eu-Li Wong speaking on healthy longevity.